Hey everybody, Luke here, and not too long ago we were talking about pain and the different types of pain, and it was a blog post I did probably about 6 months ago. It was called "No Pain, No Gain: How This Mentality Will Oftentimes Leave You Stuck," and it was all about how this old school mentality that you need to push through pain, it can sometimes just backfire on people and really gives them a lot more pain in the future. And it's kind of like I said, an old school mentality. A lot of folks in my generation don't go there because I guess we're a little less tolerant of pain and things like that. So today is kind of a follow-up to that one, and it's another question that I hear a lot of is like, when is it good to have pain? And it usually comes up for me during treatment. So a lot of times if folks are doing it on their own, I mean, it's pretty standard if I say, look, if you're doing a certain exercise or stretch or something like that and it's causing you extra pain, that's your body's very clear signal saying, stop it, modify it, don't do it so hard, but just stop it either way, do something differently. But there are certain circumstances where actually you are going to want to work through some pain, but you just want to make sure that if you are thinking of working through pain, that you're in this situation. Because if you're not, more than likely, 95% of the time, if you're working through pain, it's going to make you worse. So that's what I want to talk to you about today. It's pretty close. It is Valentine's Day today, and it's snowing behind me there. So if you haven't seen me in my pink shirt before, you probably won't see it again until next year. But that's why I'm outside and wearing this. So anyways, so here we go. So again, determining if you're having good pain or bad pain. So first thing, there's three things you want to consider. The first thing you want to consider is how the pain feels. That may sound weird, but as you probably know, there's different feelings to pain. Is it a sharp pain? Is it more of a dull, achy pain? Things like that. In general, a sharp pain is not going to be a good thing. And I think most people probably get that, but let's just knock out the easy one first. The second thing that you want to consider, and probably more than anything you want to consider, is what is causing the pain? What structures are you working on? What body part are you working on? And I'm going to give you a couple examples. So it's very common for us to see people with like a frozen shoulder, let's say, after shoulder surgery. And it may not be a full-blown frozen shoulder. It may just be, some residual tightness and things like that. And when they first come out of their surgery, they're on pain medications and things like that. And depending on how tight their shoulder is, we might work through a little bit of pain early on. A little bit, but not a whole lot, because we know what the structures are involved. We know that the surgery is stable, and we know there's inflammation because of some of the things they did in the surgery. But we also know that we have a window of opportunity to capture the flexibility in the shoulder, so to get the range of motion going. And if we don't get it then later down the road, that person is going to suffer because it's going to be stuck later and it's going to hurt more later. Also, with that shoulder surgery analogy, is that if someone is later on in the rehab process and everything has kind of died down, the inflammation from the surgery is pretty well under control, and now there's some residual loss of motion and flexibility in the shoulder, we're more comfortable now stretching that thing into more pain because we know what we're stretching, we know we're not irritating any of the structures that have been fixed, and we know that we're not going to damage anything. And so since they're a little further out from their surgery at that point, we're more comfortable, gradually adding a little more pain because we know that it's going to pay off. The other key thing then, to piggyback right off of that one, is that we also know for that person, we know the duration of the pain. We know that at that stage in the rehab process, it's going to hurt them while we're stretching and mobilizing and just trying to work on that motion as best we can. But we also know that in about 15 minutes, or maybe even 2 minutes, as soon as I stop stretching the person or one of the PTs stops stretching them, that they're not going to be in pain anymore. So that's a huge deciding factor. Because and again, with that same person after shoulder surgery, if I had stretched them that aggressively right after their surgery, 2, 3, 4 weeks afterwards, they would have been hurting for 2 days. So that's totally different. You can tolerate pain when you know the structures that you are involved. You're not having sharp pain, but it does hurt, especially if you know that the payoff is there. Ultimately, it's going to lead to less pain, and then again, in 5 minutes to 20 minutes, there'll be no pain, and in fact, you're going to feel better. So that takes some time to figure out as you're going through your rehab process, but again, we know that, and we can see that, and then we can start to be more aggressive. So that is what I would consider good pain. The other most common example we see in the clinic would be like a total knee replacement. And so if you've had one or someone who's had one, or you know somebody, again, it's a major surgery. But we also know right up front that if you don't get that flexibility back quickly, then you're going to be in a world of hurt later on. So those people are typically going to take their pain medications. They're going to stay on top of their pain that way, and they're going to take it right before they come in because they know we're going to stretch them. And they know that long-term stretching through pain at this stage in their recovery is definitely worth it in the long run because then they're not going to have pain. And if we don't do it at that point in the recovery and we let them just say, well, it hurts, so we're not going to do it, then later on their knee is not is very stiff. It won't move. And at that point, they're going to have long-lasting pain. And at that point, we're trying really hard to stretch them with very little result. So those are the two most common examples that I see and that the other therapists in the clinic see. So again, those three things: you want to determine what type of pain you're having, you want to avoid sharp pain typically, you want to understand the body parts that are involved, if there's some damage, if there's inflammation, what tissues and structures you're stretching through pain, what it's going to get you, and then you want to know how long that pain is going to last. And if it's going to be short-term pain that gets you to a result that's going to lead you to less pain in the future, then that's good pain. And that's about it. So again, come full circle. There's a lot of bad pain out there. In general, if you're having pain, I wouldn't recommend working through it. And if you have any questions on whether or not your pain should be worked through or whether it's just the old bad pain, just let me know. I'll leave my information below the video, and just let me know. I'll be happy to do my best to help you figure that out. So I hope that kind of clears things up for you. And again, more questions, just let me know. That's all for today. Happy Valentine's Day, and I'll talk to you again soon. Thanks.